Hi, my name is Elliot Hout. I'm a trauma surgeon at the School of Medicine at Johns Hopkins University. I also have an appointment at the Bloomberg School of Public Health as well. And my role at the School of Medicine is I'm a professor in the Department of Surgery with appointments in emergency medicine and anesthesiology and critical care medicine as well. And I serve as the Vice Chair of Quality, Safety, and Service for my department. The business of health matters for so many different reasons. You need to have the business of health to understand how you do clinical work. More importantly than the clinical care, I think the reason I'm really involved in the business of health initiatives are on the research and implementation side. Research is mostly focused on quality and safety. For example, we do work on prevention of blood clots. And in Maryland, we have the Maryland Hospital Acquired Conditions. Our hospitals are penalized or rewarded for the quality of care we give. As an example, we're at risk for, 10 or $20 million every year at Johns Hopkins Hospital based on the quality of care based on these MHACs, one of which is related to blood clots. So you can imagine putting money into quality improvement efforts to decrease these rates. It's good for patients, which is probably the most important reason to do something. But it's also good for the health system, and it's good for the health of the finances of the health system as well. The business of health aligns with what we do in quality and safety. It aligns with what we're doing in research.
Ting Long Dai, Bernard T. Ferrari Professor of Business at the Perry Business School. Well, first of all, business is important, right? So business is about getting things done. Over the years, people have a very different understanding about what business is, right? 20, 30 years ago, when people thought about business, people thought about leadership, management, and strategy. Those were all important. But over the years, when people think about business, and so understanding has evolved to more of data, analytics, AI. But what has not changed is to figure out a way to do things more efficiently, more effectively, to deliver what you are trying to achieve, right? In the case of health, we are trying to improve healthcare outcomes, right? To ensure healthcare solutions will not only be safe and effective, but also be compatible with clinical workflows and scalable to be able to address diverse healthcare settings. That's what we can do from the business side, and that's why business of health is very important to me.
My name is David Chin, and I'm a distinguished scholar at the School of Public Health and School of Medicine, and I've been at Hopkins since 2012. I'm in the Department of Health Policy and Management, co-direct with Steph Burrell, the MPH MBA program. I also lead an executive education program for value-based healthcare. And I also provide advice to the Center for Population Health IT at the School of Public Health. From a few perspectives. One is that, at least in the United States, and I think also for most countries, healthcare is the dominant sector of the economy, and healthcare is like 20%. So when it's that big, it's really important. That's number one. Number two, if you don't focus on the business part of health, then it's really not sustainable. As they say, no margin, no mission. So there has to be something that will sustain the enterprise. So that's number two. Number three, at least in the United States, there is enormous waste in the healthcare system. And so because it's so large, it's crowding out other potential investment.
Insightful hearing about our faculty's perspectives on the business of health. Khue and Godson, I'd love to hear your own personal relationship with the business of health.
Yeah, so for me, access and affordability are really key. So I believe understanding healthcare through the business lens will allow us to better understand cost drivers and how we can best address them as we're confronted with rising healthcare expenditures. Godson, what do you think?
Yeah, I mean, I see healthcare, the business side of healthcare, from the three P's that I know: the providers, the payers, and of course the patients. And from my perspective, I've been a provider at some point, also been a patient at some point, and always wanted to see things from the payer's perspective. I've read about it, worked with the market access team that actually works with the payers, but it would be great to see the 360 view of that. How about you, Nina?
Yeah, I think similar to you both, you know, really being able to have an understanding of the business case and how the private sector interacts with healthcare, both in public and private spaces, has helped and will really continue to help me as I stay rooted more in the public healthcare space while thinking about access to care and disparities across populations.
So yeah, it's been an amazing year in the HBHI with the faculties and other students who were also in this program. But hey Dan, I have a last word for you. I look forward to that Astro-Wayne rematch again, and I know I'll still beat you, right?
Oh yeah.
Thank you so much.
Thanks.
All right, bye-bye.